Welcome to our video which demonstrates to you how to position your patient properly for the treatment with HiToPCenter. The following details should be considered before starting with HiToPCenter. Please switch on the main switch of the special HiTop bench. Following, turn on the switch for the heating of the electrodes. The electrodes are placed in the drawer. Select an intensity between 1 and 5 to heat up the cushion. Press the button again and the LED will blink. The blinking LED indicates that the cushion is heating up. Your patient should go to the bathroom before starting any HiToPCenter. Cell phones and any other electronic equipment must be switched off. Ask your patient for pacemaker or implanted defibrillator. These devices are contraindications. Further contraindications are an acute bacterial infection as well as pregnancy. Arrange for a comfortable and relaxing atmosphere. Support your patient's head with a small neck pillow and place another pillow under his feet so that the feet are slightly higher positioned than the head. When your patient confirms a comfortable position on the bench, you should start to place and attach the electrodes. Welcome to our video which demonstrates to you the application for the whole body treatment with HiToPCenter. The whole body treatment should, if possible, be done together with any local application in order to improve the results of HiToPCenter. The whole body treatment requires the application of 5 electrodes. Prior to placing the electrodes, each electrode must be sprayed with the contact spray. The first 2 electrodes are placed under the feet. It is essential that the electrodes cover the skin completely. The 2 connectors of the electrode must face to the toes. The next 2 electrodes are placed on the 2 arms above the wrists. It is essential that the electrodes cover the skin completely. We do recommend to place 1 electrode in the patient's neck. However, this is optional. Yet, if you choose to take advantage of this electrode, just place it between neck pillow and neck. For the whole body treatment, you need 5 cables, 3 with a white connector and 2 with a black connector. The 2 black plugs are connected to each electrode under the feet. The 3 white plugs are connected to the 2 arms and 1 to the electrode in the neck. To start the therapy, you select the channel, in our case the red one, and push the button. Afterwards, you choose Simulform I and you start to increase the intensity until your patient feels a light tickling in one of the electrodes. Press the Continue button. Now increase again the intensity until your patient notices once again a tickling in one of the electrodes. Then press the Continue button again and the therapy has been started. You might wish to cover your patient with a blanket or towel. Remember, look after your patients from time to time to give them the feeling of being well shepherded. Welcome to our video which demonstrates to you the application with HiToPCenter for knee arthrosis treatment. For the treatment of knee arthrosis, we first place 2 electrodes on the joint of the affected knee. Place 1 on each side of the knee for Simulform I treatment. Take another pair of electrodes and place 1 electrode on the calf and the other one on the thigh of the patient's leg for Simulform X 100 Hz treatment. It is essential that the electrodes cover the skin completely. We show this on the video. Now connect the green channel to the electrodes on the knee joint, 1 black connector and a white one. Then you do the same with the yellow channel, as it is shown on the video. Please connect the electrode fixed to the calf to the black connector and the electrode fixed on the thigh to the white connector. Now to start the therapy, you select the channel, in our case the green one. Following, you choose Simulform I and you start to increase the intensity until you receive a positive feedback from your patient. Press the Continue button. Now you can increase the intensity until your patient feels the tickling. Now press the field Next channel and the yellow channel is automatically reselected. Please increase the intensity until your patient feels the tickling. Now press the field Next channel and the red channel is automatically reselected. Start to increase the intensity until you get a positive feedback from your patient. Press the Continue button. Now again, increase the intensity until your patient feels a tickling again in one of the electrodes. Press the Continue button and the therapy has started. Welcome to our video which demonstrates to you the application with HiToPCenter for polyneuropathy treatment. For the treatment of polyneuropathy, we place 2 electrodes in a row on each thigh of the patient and we use the special program for polyneuropathy treatment with HiTop. We recommend to use EasyFix electrodes as shown on the video. Place a small pillow below the knees, just as demonstrated on the video. Connect the green channel to the electrodes on one thigh, one black connector and a white one. The electrode fixed just over the knee should be connected to the black connector and the electrode fixed below the groin to the white connector. Now connect the yellow channel to the electrodes on one thigh, one black connector and a white one. Please connect the electrode fixed just over the knee to the black connector and the electrode fixed just below the groin to the white connector. In order to start the therapy, you select the channel, in our case the green one. Increase the intensity until we see a good muscle stimulation at the thigh. Then proceed in the same way with the other channel, in this case the yellow one. To start the whole body treatment, we select the red channel in this case. Then please choose Simulform I and start to increase the intensity until you get a positive feedback from your patient. Press the Continue button. Now again, increase the intensity until your patient feels a tickling again in one of the electrodes. Press the Continue button and the therapy has started.